As we age, one of the most significant changes that impact morning erections is the natural decline in testosterone levels. Testosterone is the hormone responsible for many aspects of male health, including sexual function, muscle mass, mood, and even bone density. However, as men get older, typically after the age of 30, their testosterone levels begin to gradually decrease by about 1% per year. While this might sound like a small drop, it can have a noticeable effect over time. Morning erections, or what we refer to as morning wood, are largely driven by testosterone levels. These spontaneous erections are part of a process called nocturnal penile tumescence, which happens during certain phases of sleep, specifically during REM sleep. As testosterone levels decrease, the frequency and strength of these nocturnal erections can diminish as well. This is a natural part of the aging process, but it can be concerning for many men who notice this change. Now, it's important to note that testosterone doesn't act alone. It works alongside other factors, like overall health and blood circulation, to support erectile function. But when testosterone levels start to dip, it becomes harder for the body to perform at its usual levels. Think of testosterone as the fuel that keeps the engine running smoothly. As the fuel decreases, the engine may not run as efficiently. This is why men often see a reduction in morning erections as they age. It's also crucial to understand that the decline in testosterone doesn't necessarily mean that a man will experience erectile dysfunction. While low testosterone can contribute to issues with sexual function, it's not the sole factor. Other things like blood flow, psychological health, and even lifestyle choices play important roles as well. However, when testosterone levels fall, it can definitely make everything else a bit harder to manage. So what can be done about it? The first step is recognizing that this is a natural part of life, but it doesn't have to be something you simply accept. If you're noticing a decline in morning erections or other symptoms like decreased energy, reduced muscle mass, or changes in mood, it might be time to talk to your healthcare provider about testing your testosterone levels. There are treatment options available, ranging from lifestyle changes to medical interventions. Simple things like improving your diet, exercising regularly, and getting enough sleep can help boost testosterone production naturally. In some cases, hormone replacement therapy or other medical treatments may be recommended, but this is something to discuss thoroughly with your doctor. Remember, there's no one-size-fits-all approach, and what works for one person may not work for another. Ultimately, while a decrease in morning erections as you age can be linked to lower testosterone levels, it's not something that should lead to panic. Instead, it's an opportunity to learn more about your body, seek proper medical guidance, and take proactive steps to maintain overall health. So with that in mind, let's dive deeper into the next aspect of why morning wood disappears with age and how we can continue to tackle this issue head-on. As we continue to explore why morning wood tends to disappear with age, another crucial factor to consider is reduced blood flow. This is something many people don't immediately associate with sexual health, but it plays a fundamental role in erectile function. Our bodies rely on a healthy circulatory system to deliver oxygen and nutrients to all the right places, and when blood flow to the penis is compromised, erections can become less frequent, less firm, or even absent altogether. When we're younger, our arteries and blood vessels are generally in good shape, but as we get older, things naturally begin to change. Arterial walls can stiffen, and plaque can build up in the blood vessels, a condition known as atherosclerosis. This buildup can cause the arteries to narrow, restricting blood flow throughout the body, including to the penis. Since erections rely heavily on blood filling the penile chambers, any reduction in blood flow can make it more difficult for men to achieve or maintain an erection, particularly in the mornings. Another aspect of aging that can affect blood flow is the natural decline in nitric oxide production. Nitric oxide is a molecule that helps blood vessels relax, allowing them to expand and increase blood flow. As we age, the ability of our blood vessels to respond to nitric oxide decreases, which can make it harder for blood to flow into the penis during those critical times when morning erections should be occurring. Reduced nitric oxide levels are one of the main contributors to erectile dysfunction, especially in older men. But blood flow issues don't only stem from aging alone. Lifestyle factors play a massive role in how well our circulatory system functions. If you're not taking care of your heart health, whether through poor diet, lack of exercise, smoking, or excess alcohol consumption, it can directly affect blood flow throughout your body. Conditions like high blood pressure and high cholesterol also contribute to poor circulation and increase the risk of erectile dysfunction. For example, smoking is particularly damaging because it not only contributes to the buildup of plaque in arteries, but also impairs the function of blood vessels, making it harder for them to expand when needed. The result, less blood flow to the penis. Similarly, obesity and diabetes can damage blood vessels over time, creating an environment where circulation is compromised. The good news is, blood flow is something we have some control over. By making changes to our lifestyle, we can improve circulation and in turn support erectile health. Regular physical activity, especially cardiovascular exercise, helps to keep the heart healthy and the blood flowing freely. A healthy diet rich in fruits, vegetables, and healthy fats can support healthy blood vessels, while limiting processed foods, excessive salt, and sugar can help manage blood pressure and cholesterol levels. It's also important to consider stress. Chronic stress can lead to the release of stress hormones like cortisol, which can constrict blood vessels and reduce circulation. So managing stress through activities like meditation, yoga, or even just taking time to unwind can improve overall blood flow and, by extension, sexual health. By recognizing that blood flow is a major contributor to morning erections, we can begin to take steps to address it. It's not just about addressing erectile function, it's about ensuring that our circulatory system remains strong and healthy for all aspects of our lives. Another factor that can significantly impact morning erections as we age is our sleep patterns. Sleep is often underestimated in terms of its importance to sexual health, but it plays a critical role in how our bodies function overall, including how well we experience and maintain erections. A good night's sleep is essential for hormone regulation, particularly testosterone, which, as we discussed earlier, is key to sexual function. When sleep quality declines, so can the frequency of morning erections. But how exactly does sleep influence our sexual health? During sleep, particularly during the REM rapid eye movement phase, the body experiences cycles of spontaneous erections. These nocturnal erections are a sign of healthy circulation and nerve function, and they're also linked to the body's testosterone production, which peaks during sleep. This means that if you're not getting enough sleep or your sleep is fragmented, your body may not have the opportunity to fully recharge its testosterone levels, which directly impacts the occurrence of morning wood. Sleep apnea, a condition where breathing stops and starts throughout the night, is another significant disruptor of sleep quality and consequently sexual health. Sleep apnea reduces oxygen levels in the blood and can cause intermittent awakenings, which severely interrupts the body's ability to enter the deeper stages of restorative sleep. When sleep is disturbed, it disrupts hormone production, increases stress hormones like cortisol, and ultimately affects how well the body functions in the morning. In fact, studies have shown that men with untreated sleep apnea are more likely to experience erectile dysfunction, often due to the combined effects of poor sleep and low testosterone. Even outside of sleep disorders, many men experience poor sleep due to lifestyle factors like stress, late-night screen time, or irregular sleep schedules. Stress, in particular, has a huge impact on both sleep quality and sexual health. When you're stressed, your body produces more cortisol, which not only interferes with sleep, but also suppresses testosterone production. This creates a vicious cycle where poor sleep leads to low testosterone, which further impacts morning erections and overall sexual vitality. Another culprit is irregular sleep patterns. If you're someone who doesn't maintain a consistent bedtime or who's frequently waking up at odd hours, your body's internal clock or circadian rhythm becomes disrupted. This rhythm is deeply connected to testosterone production, as levels are typically higher in the morning and decline throughout the day. Disrupting this natural rhythm can lead to a drop in morning erections, even if the testosterone levels themselves aren't particularly low. So what can we do to improve sleep quality and in turn sexual health? First, it's crucial to prioritize a consistent sleep schedule. Going to bed and waking up at the same time each day can help regulate your circadian rhythm and support healthy hormone production. If you suspect sleep apnea, it's essential to get evaluated by a healthcare provider, as untreated sleep apnea can have serious long-term effects on both your cardiovascular and sexual health. Reducing stress is another powerful tool. Engaging in relaxation techniques like meditation or deep breathing before bed can improve sleep quality and reduce the impact of cortisol on your body. In addition, limiting exposure to screens, especially blue light from phones, computers, and TVs, an hour or two before bed can help your body naturally prepare for rest. Creating a calming bedtime routine such as reading or taking a warm bath can signal to your brain that it's time to wind down. Sleep is an often overlooked piece of the puzzle when it comes to morning erections, but it's clear that its impact is profound. By taking steps to improve the quality and consistency of our sleep, we can not only improve our sexual health, but our overall well-being. Let's move on to another crucial factor that affects morning wood as we age: stress and anxiety. In today's fast-paced world, it's almost impossible to avoid stress completely. Whether it's work pressures, relationship issues, or simply the overwhelming feeling of juggling daily responsibilities, stress can take a significant toll on our bodies. But the connection between stress and erectile function is something many don't immediately recognize. It goes beyond just feeling overwhelmed. It has a very real physiological impact on sexual health, particularly when it comes to spontaneous erections. When we're under stress, our bodies react by releasing a hormone called cortisol. Cortisol is often referred to as the stress hormone, and its job is to prepare the body for a fight-or-flight response. This means that when stress levels rise, cortisol increases, putting our body into a heightened state of alertness. In the short term, this is useful. It helps us stay sharp and react quickly in stressful situations. But when stress becomes chronic, the prolonged release of cortisol can wreak havoc on our hormone balance, including suppressing testosterone production. This is where the trouble starts. Testosterone, as we've established, plays a central role in sexual function and morning erections. When stress is continually pushing cortisol levels up, it directly interferes with the body's ability to maintain healthy testosterone levels, which in turn impacts erectile function. Chronic stress can also affect the autonomic nervous system, which controls involuntary functions like heart rate and blood pressure. This system is also responsible for triggering the mechanisms that lead to an erection. When stress dominates, it can interfere with the signals that tell your body to engage the processes needed for an erection. The result? Morning wood becomes less frequent, and even when it does occur, it may not be as strong or as consistent as it once was. Anxiety, which often accompanies stress, adds another layer to the equation. Anxiety can cause a constant state of hypervigilance, where you're always on edge or worried about potential problems, whether they're real or imagined. This constant worry can lead to tension in the body and a heightened fight-or-flight response, further increasing cortisol levels. Over time, this can contribute to erectile dysfunction, particularly in situations where performance is involved, like during intimacy. Anxiety about sexual performance can create a vicious cycle. You become anxious about not being able to perform, which in turn makes it harder to perform, and the stress of worrying about it only compounds the issue. On top of that, stress and anxiety can disrupt sleep, which we've already discussed as a key factor in maintaining morning erections. Poor sleep caused by stress only exacerbates the problem by impacting testosterone production and the body's ability to repair itself overnight. It's a cycle that feeds on itself, and it can make it feel like you're losing control over your body's functions. The good news is, stress and anxiety are manageable. One of the most effective ways to tackle this issue is by practicing relaxation techniques. Meditation, deep breathing exercises, yoga, and mindfulness have been proven to reduce cortisol levels and help bring the body back into balance. Even simple activities like going for a walk outside, listening to calming music, or engaging in a hobby can lower stress and improve mental well-being. Another powerful tool in managing stress is regular physical activity. Exercise, particularly aerobic activities like running, cycling, or swimming, can reduce stress hormones and trigger the release of endorphins, those feel-good chemicals that help combat anxiety. Moreover, regular exercise has the added benefit of improving blood flow and overall cardiovascular health, which, as we've discussed earlier, plays a crucial role in erectile function. If anxiety about sexual performance is a contributing factor, it may be helpful to speak with a professional. A therapist or counselor who specializes in sexual health can help address performance anxiety and teach you coping mechanisms. Sometimes, simply having an open conversation about these concerns can ease a lot of the tension and help shift your mindset. Ultimately, while stress and anxiety are inevitable parts of life, they don't have to dictate your health or sexual well-being. By taking steps to reduce stress and manage anxiety, you can improve both your mental and physical health, which in turn will help bring back some of that natural vitality, including morning erections. Now, let's turn our attention to another significant factor that impacts morning erections as we age: lifestyle choices. The way we live our lives, day in and day out, has a profound effect on nearly every aspect of our health, especially when it comes to sexual function. The choices we make around what we eat, how active we are, whether we smoke or drink, and how we manage our weight, all play pivotal roles in how well our bodies perform, both in the bedroom and beyond. And while these choices may not seem directly linked to morning wood, the truth is, they're intimately connected. For example, let's start with diet. What we eat is the fuel our bodies run on, and when we feed ourselves nutrient-dense whole foods, we're providing the building blocks for better health, both sexually and overall. On the flip side, a diet high in processed foods, sugars, and unhealthy fats can contribute to a host of issues, from weight gain to poor circulation, both of which can interfere with erectile function. A poor diet can increase the risk of cardiovascular disease, which is one of the most common causes of erectile dysfunction. If the blood vessels that deliver blood to the penis become clogged or stiffened, it becomes much harder to achieve an erection. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins can help protect the heart, improve circulation, and maintain healthy testosterone levels. Foods like leafy greens, berries, nuts, and fatty fish like salmon are packed with antioxidants and nutrients that support both vascular health and hormone balance. Additionally, foods rich in zinc and vitamin D, such as oysters, eggs, and fortified cereals, have been linked to better testosterone production and improved sexual health. In short, the healthier your diet, the better your body can support its sexual function. Next, let's talk about exercise. Regular physical activity has a huge impact on nearly every system in the body, including sexual health. Exercise helps improve blood flow, boost testosterone levels, and support overall cardiovascular health, all of which are essential for healthy erectile function. One of the best ways to support blood flow and circulation is through cardiovascular exercise. Activities like running, swimming, cycling, or even brisk walking get the heart pumping and the blood flowing. But strength training also plays a key role by helping to maintain muscle mass and boost metabolism, both of which are beneficial for testosterone levels. But it's not just about staying active, it's also about staying in a healthy weight range. Obesity is one of the major risk factors for erectile dysfunction, and it has a significant impact on both hormone levels and blood circulation. When excess fat accumulates, especially around the abdominal area, it can lead to an imbalance in hormones with higher levels of estrogen and lower levels of testosterone. Being overweight also increases the risk of other conditions like type 2 diabetes, high blood pressure, and high cholesterol, all of which can further compromise erectile function. Then of course there's smoking. Smoking is one of the most detrimental lifestyle choices for erectile health. The chemicals in cigarettes damage blood vessels and reduce blood flow throughout the body, including to the penis. Smoking accelerates the process of atherosclerosis, or the hardening of the arteries, which limits blood flow and makes it harder to achieve and maintain an erection. Quitting smoking can significantly improve circulation and increase the chances of experiencing stronger, more frequent erections. Alcohol consumption is another area to be mindful of. While a small amount of alcohol may help with relaxation, excessive drinking can have the opposite effect on sexual health. Alcohol is a depressant, and over time heavy drinking can negatively impact both libido and erectile function. Chronic alcohol use has been shown to interfere with the body's ability to produce testosterone, and it can also impair nerve function, making it harder to achieve an erection. Moderation is key. And if you're struggling with alcohol dependence, seeking support can be an important step in restoring your sexual health. In sum,
Lifestyle choices have a huge impact on erectile function and overall health. By making small, manageable changes to your diet, exercise routine, and habits like smoking and drinking, you can take proactive steps toward improving not only your morning erections, but your overall quality of life. It's about understanding the importance of what we put into our bodies and how we treat them, and realizing that these small changes can lead to big improvements in both your physical health and sexual vitality. Let's dive into another important factor that often goes unnoticed when we're talking about why morning wood tends to disappear as we age: medication side effects. Many men in their middle age and beyond find themselves taking medications for a variety of health conditions, from high blood pressure to diabetes, depression, or even just general aches and pains. And while these medications are often life-saving or necessary for managing chronic conditions, they can also come with a range of side effects, some of which can directly impact sexual health. One of the most common and often overlooked side effects is the effect medications can have on erectile function. Certain classes of medications can interfere with blood flow, hormone production, or nerve function, all of which are essential for achieving and maintaining an erection. For example, medications used to treat high blood pressure, like beta blockers or diuretics, can reduce blood flow by narrowing blood vessels or affecting heart rate. Since erections are heavily dependent on blood flow, these medications can make it more difficult for men to experience spontaneous erections, especially in the morning. Similarly, medications for depression and anxiety, such as SSRIs, selective serotonin reuptake inhibitors, can interfere with sexual function by affecting the brain's neurotransmitters, including serotonin, dopamine, and norepinephrine, chemicals that play a role in arousal and sexual pleasure. One of the common side effects of these medications is a reduced libido, or difficulty achieving an erection. It's not just the cardiovascular or psychiatric medications that can cause issues. Even common over-the-counter drugs, like antihistamines or decongestants, can affect erectile function. These medications often work by blocking certain receptors in the body, which can lead to reduced blood flow or nerve sensitivity. This is particularly true for medications that alter the balance of other hormones, like corticosteroids, which are sometimes prescribed for inflammatory conditions. Long-term use of corticosteroids has been linked to lower testosterone levels, which, as we've seen, can have a direct effect on erectile health. Then there are the medications prescribed for conditions like diabetes, which is known to have a significant impact on sexual health. Men with diabetes often face issues with nerve function and circulation, both of which are critical for normal erectile function. Medications used to manage blood sugar can also have side effects that affect sexual performance. For instance, some medications can cause fluid retention or affect the way blood vessels function, further complicating circulation. In addition to prescription medications, even over-the-counter supplements and herbal remedies can sometimes interfere with sexual health. While many men turn to supplements in an attempt to boost energy or libido, not all of them are safe or effective. Some can have unintended interactions with other medications, or even create their own set of side effects that contribute to erectile dysfunction. It's important to be cautious with these and speak with a healthcare provider before starting any new supplement regimen. So what can you do if you suspect your medication is affecting your sexual health? The first step is to have an open conversation with your doctor. Don't be embarrassed or shy to discuss any changes in your sexual function, including a decrease in morning erections. Your doctor can work with you to adjust your medication regimen, either by switching to a different drug or finding a dosage that minimizes side effects. Sometimes, managing the underlying condition in a different way can help mitigate these issues. In other cases, your healthcare provider may recommend additional treatments for erectile dysfunction, like phosphodiesterase inhibitors, such as Viagra, which can help improve blood flow and counteract some of the effects caused by medications.
It's also important to never stop or adjust your medications on your own without consulting a healthcare provider. Stopping certain medications abruptly, especially those used for managing chronic conditions like high blood pressure or diabetes, can lead to serious health risks. But with guidance from your doctor, it's often possible to find a solution that addresses both your general health and your sexual health. Medication side effects are a significant but often overlooked cause of changes in erectile function as we age. By being proactive and having open conversations with your healthcare provider, you can take control of your health and find solutions that work for you. It's about balancing your overall well-being with your sexual health and understanding that you don't have to accept these changes without exploring options. As we wrap up our discussion on the factors that contribute to the disappearance of morning wood with age, we can't ignore the impact of underlying health conditions. These conditions, often developing slowly over time, can seriously affect sexual health and, more specifically, erectile function. Things like diabetes, hypertension, obesity, and even metabolic syndrome play a central role in the decline of morning erections. The truth is, these chronic conditions are not just about managing symptoms, they can also have a significant long-term impact on the body's ability to perform sexually. Take diabetes, for example. It's one of the most common and well-known contributors to erectile dysfunction. High blood sugar levels over time can damage nerves and blood vessels throughout the body, including those that supply blood to the penis. This damage can interfere with the delicate process that allows for an erection to occur, making it more difficult for a man to experience spontaneous erections in the morning. In fact, men with poorly controlled diabetes are at a much higher risk of developing erectile dysfunction. But it's not just the damage to the blood vessels and nerves that makes it more difficult, it's the way that the body's overall metabolic balance is disrupted. Insulin resistance, a hallmark of type 2 diabetes, can lower testosterone levels, further contributing to diminished sexual health. Hypertension or high blood pressure is another common condition that has a direct effect on erectile function. When blood pressure is high, it puts extra strain on the heart and blood vessels, making them less flexible and less efficient. This can impair circulation, and because erections rely so heavily on healthy blood flow, the risk of erectile dysfunction increases. In fact, erectile dysfunction can sometimes be an early warning sign of cardiovascular disease, as the smaller blood vessels in the penis are often the first to show the effects of poor circulation. If blood vessels are stiff or narrow due to hypertension, achieving and maintaining an erection becomes more difficult. Obesity is yet another significant factor that can contribute to erectile dysfunction. Being overweight can lead to a number of complications that affect sexual health, including insulin resistance, lower testosterone levels, and poor circulation. Fat tissue, particularly around the abdominal area, produces estrogen, which can further disrupt hormone balance and reduce the body's ability to maintain an erection. Additionally, excess weight is often linked to other health issues like high cholesterol and diabetes, both of which we know are closely tied to erectile problems. Metabolic syndrome, which is a collection of conditions like high blood sugar, high blood pressure, high cholesterol, and excess body fat, is another key player in the decline of morning erections. When any of these conditions are left unmanaged, they contribute to a cascade of issues that affect both vascular and hormonal health. Metabolic syndrome increases the risk of heart disease and stroke, and it also significantly raises the likelihood of developing erectile dysfunction. In fact, research has shown that men with metabolic syndrome are more likely to experience erectile dysfunction earlier than those without it. The reality is, many men are dealing with multiple health conditions simultaneously, and the effects of these can compound one another. For instance, a man with high blood pressure who is also overweight may find that his erectile function is more affected than if he were only dealing with one of these issues. The good news, however, is that managing these underlying conditions can make a significant difference in sexual health. If you're dealing with any of these health concerns, it's important to work closely with your healthcare provider to manage them effectively. Keeping blood sugar levels under control, lowering blood pressure, losing weight, and improving cardiovascular health through exercise and diet can all help restore erectile function. Additionally, treating any underlying hormonal imbalances or addressing sleep issues can also help improve morning erections. Addressing these conditions not only helps with sexual health, but also improves overall well-being. It's about taking a comprehensive approach to health, understanding that sexual function is often an early indicator of broader health issues. By taking control of these underlying conditions, you can protect both your long-term health and your ability to enjoy a fulfilling sex life.